All right, welcome everyone. Today we continue our infectious disease discussion. It's very important. Case scenarios. Okay, so you see 34-year-old comes in with tongue lesion that is painless, 2 centimeter ulcer with induration, and the dorsal aspect of the tongue. And then they ask you, okay, what's the best next step? This is so painless ulcer in the penis or in the tongue. It's syphilis. This is a trypanema. So that's what they want you. Enzyme immunoassay. This is what they want you to know. Okay. All right. Now somebody with syphilis treated with penicillin, and then they develop fever, chills, aches, macular rash. So what do you do? You give Tylenol. This is Jarisch hexamer reaction after syphilis treatment. This can happen because of the bacteria could go to the system and cause some kind of reaction. Usually 6 to 48 hours after initiating treatment, and most commonly with the primary and secondary syphilis, and seen with the treatment of other spirochete like Lyme disease, leptospira as well can happen. Fever, chills, myalgia, rash progression in secondary syphilis. You can see that. The treatment is just IV fluid, Tylenol, NSAID, self-limiting within 48 hours. It goes away. Okay, that is Jarisch hexamer reaction. All right. So now, 22-year-old had tick removed and has some rash. It's only 1.5 long brown tick, and then they tell you what's best next step is nothing. Just reassure, follow skin rash. So if there's a rash, not typical like with central clearing, this is not Lyme, you know. And then basically they just want you to know the criteria of Lyme prophylaxis. Must be within 72 hours, 36 hours, 20%, 8. So these are the numbers that you need to remember. 36 hours means tick attached for more than 36 hours. 72 need to be started within 72 hours. 8. No contact, like somebody with age less than 8, you give doxy. You don't give doxy. I mean, you give something else. Like you don't give prophylaxis. I mean, and someone who have deer tick, you know, which is different tick, you know. All right, different than the one that they describe here. All right, now we have 63 or 64 came in. With left foot pain, it's been going on for 3 weeks, and then you have 2x2 ulcerated lesion at the base of the left first metatarsal with a purulent drainage at the base, and there is a X-ray showing cortical erosion and elevated periosteum. This is indication. This is description of osteomyelitis. So what you want to do, bone biopsy and debridement. Okay, so consult wound care or podiatry, you know, to debride the osteomyelitis. This is already confirmed osteomyelitis. Okay, now they give you another patient like who have like is 66 with fever, fatigue, splenectomy, crackles, low platelet, elevated liver enzymes, bilateral infiltrate, you can see that. And then they give you peripheral smear with Maltese cross. And then they tell you what's the diagnosis. This is babesia. Okay, something you need to be aware of. Babesia is usually by the tick Ixodes scapularis, and can happen from protransfusion as well. Northern United States, it's common. So malaria is in Africa, but babesia is more common in the US. Usually in HIV immunosuppressed patient have higher risk for that. Could be mild, like just fatigue, myalgia, headache, or could be severe, like cause DIC, heart failure, ARDS, liver failure, splenic rupture, and you have anemia and thrombocytopenia, obviously. Peripheral smear, you see Maltese cross, or they describe intraarthrocytic pleomorphic ring form. They can tell you about that. And then the PCR, your detection of babesia DNA in the blood. Okay, and then serology may be negative in acute infection. Okay. Now, someone ask you, they want to travel, how to tell you how to prevent travel diarrhea. You give azithromycin, believe it or not. Okay, azithromycin kill the bacteria that cause travel diarrhea, which are ETEC, Campylobacter, and Salmonella. These are the common ones. So you can do quinolone as well for adult man and non-pregnant adult woman. Okay, azithromycin is preferred in children and for travel to Southeast Asia. Why? Because there is a quinolone resistance in Southeast Asia. So you use azithromycin. Otherwise, in other parts of the world, you can do quinolone. It's fine. Okay, now they tell you 25-year-old woman with a primary syphilis, and then tell you best next step, just penicillin, 1 dose, one time. This is for primary syphilis. Okay. Alternative, you can do doxycycline for 2 weeks. Okay. This is for primary and secondary. What if it was late, or we don't know the duration, or there's cardiovascular complications? Then you do 3 doses for once a week. Or you can do doxycycline for 4 weeks. This works too. Okay, how about neurosyphilis? This is every 6 hours for 2 weeks. Or if you can't, you do Recephin. Okay. Now this patient, 33 man with perianal itching, excoriation at night. So diagnosis, this is enterobius vermicularis. Okay. It's pretty easy, typical question for that. Alright, now you have 52 came in from Bangladesh. Have fever, left lower quadrant, abdominal pain, macular patchy rash on lower abdomen. Okay, there's anemia, thrombocytopenia, transaminitis. This one diagnosis is typhoid fever. Okay, because it has 3 weeks. Okay, week 1 has rising fever, bacteremia, relative bradycardia. This patient also relative bradycardia. And then the second week you have abdominal pain, rose spot on the trunk and abdomen. And the week 3 you have hepatosplenomegaly, intestinal bleeding, and perforation. Okay, that's the typhoid fever. Okay, now this patient is interesting. 62-year-old, swollen knee, erythematous, and then they ask you what's his best next step. You aspiration of joint fluid, okay, to diagnose if there's septic arthritis. All right, to summarize, we talked about septic arthritis, typhoid fever, we talked about enterobius vermicularis, perianal itching, penicillin, for syphilis, azithromycin for travel diarrhea, babesia for Maltese cross, bone biopsy for osteomyelitis, nothing for skin rash, Tylenol for reaction to syphilis treatment, check for troponemal if there's painless skin ulcer. That's a summary of this.